primary care physicians and certainly politicians are not equipped to determine the etiology of depression or any other set of mental health symptoms, and to be able to determine the most appropriate course of treatment for that individual.
All right, welcome everyone to a special recording of the CGI Disruptors at Work podcast. I am here today with the illustrious Dr. Janet Cummings, co-founder of Cummings Graduate Institute. And I reached out to Dr. Janet earlier this week to talk about the recent news headline among many, many of the flurries of headlines that we've had recently, because it specifically targets the mental health population of patients that we have long been advocating for and caring for as practitioners. So the facts, in short, are that shortly after Robert F. Kennedy Jr. was sworn in as the Secretary of the Department of Health and Human Services, President Donald Trump issued an executive order calling for a team to study the use of antidepressants, antipsychotics, and obesity medications in children, claiming that these medications cause a threat to adolescents. So this is under the formation of the Make America Healthy Again Commission, to be chaired by Kennedy, with the aim to understand chronic diseases. However, Kennedy has been critical of medications in the past and has falsely linked the use of antidepressants to school shootings, and has also made claims that individuals who are on SSRI medications or antidepressant medications need to be put into camps to heal, to detox from the medications, etc. He also has talked about stimulants, and that may be his next attempt to go after that. But the ultimate thing that we want to talk about today is some of the ways that we at Cummings Graduate Institute train our students to be prepared to facilitate conversations with prescribers around the use of what we call psychopharmaceutical medications, meaning medications that are prescribed to treat common mental illness diagnoses. So I want to thank Dr. Janet for joining me on such short notice today. Sure. This is an issue that has been brought to me by colleagues as well as personal friends in my life whose children are taking SSRI type medications, antidepressant medications, as well as themselves. And they're very obviously worried about their own safety as well as the security of their own medical records. And they're also asking, what is the mental health provider community doing to advocate for us? And so this is really a complex bailiwick of an issue, but I thought let's begin by just grounding the conversation in Biodyne Model, the Biodyne Model, and the way that we approach the use of antidepressant or other psychiatric medications. And so, Dr. Janet, you and your father have long written about the idea of restoring psychotherapy, therapy in general, as the first line treatment for individuals who are suffering from mental health conditions. So would you want to say a little bit about that and how we train our students from that concept?
Sure. The Biodyne Model sees psychotherapists, psychologists, clinical social workers, counselors as the first place for people with mental health issues to go, even though typically the primary care doctor is the first contact for mental health issues. But it's that psychologist, social worker, doctor of behavioral health, ideally, who knows how best to treat that patient. One example is depression, and depression is not one illness. It's often lumped together in the literature and in the way we think as one illness, but it's at least 5 different illnesses. For example, there's reactive depression, where we're reacting to a situation in our lives. There's depression that is caused by a biological reason, such as a thyroid, a hormonal problem, postpartum hormone crashes, pituitary tumors. There's a long list, medication side effects that cause depression. There's chronic depression from early childhood. There is cyclical depression, bipolar. There's complicated grief. Grief is not depression, but grief can be complicated if there's depression also. And depending on the type of depression that somebody has, we're able to formulate a treatment plan that's most likely to be effective. If you read the literature, it looks like psychotherapy and medications are each, about equally effective, and they, treat this percentage of people with depression effectively. But if you target the approach, treatment success rates can go way up. For example, if somebody has reactive depression, they're reacting to some situation or series of situations in their lives, that is best treated by psychotherapy to fix whatever it is that's going on that's making that individual unhappy. Medication can possibly be used as an adjunct to help that person be able to function in their life while they're working with a therapist to fix whatever is wrong in their life. On the other hand, you can talk therapy until the cows come home. And if depression is being caused by something biological, talking, may lend some support. It may help a little bit, but it's not really going to fix the problem. And so we need to look at what is biologically awry. Is this a medication side effect? Oh, do we need to change the medication? Is this a symptom of hypothyroid? Do we need a thyroid medication? Is this a brain inflammation? Is it a brain imbalance? In that case, perhaps we need to tackle it medically. Primary care physicians and certainly politicians are not equipped to determine the etiology of depression or any other set of mental health symptoms, and to be able to determine the most appropriate course of treatment for that individual.
Absolutely. Well said. And this is something that we really talk a lot about with our students, because
Absolutely.
oftentimes they have been trained in master's degree level healthcare professions previously, such as nursing, social work, marriage and family therapy, counseling. A couple of them have been physician's assistants. And oftentimes what they have been told previously is that medication is the first line treatment for depression. As you mentioned, the various types of depression might have the same types of symptoms, but without going deeper into root cause analysis, which again, primary care and certainly politicians are not qualified to do, we really are being irresponsible by providing a prescription.
Yeah. And, my primary care doctor consults with me on a regular basis, and often the consultation ends with, you need to refer that person to a mental health professional. Here's some people that I know in the community that I think would be helpful. And, he unfortunately wasn't even aware of how long SSRI withdrawal effects can take. Oh, a few days. No,
Yeah.
can be months. And so,
Right.
no offense to people in other professions, we need all of our healthcare workers as part of a team to address in an integrated way physical and mental health issues, but it's the mental health people that know mental health, not the primary care doctors, not the non-psychiatric nurses, and again, certainly not the politicians.
Certainly.
And I think that medication became the first line of defense more for political and financial reasons than for evidence-based healthcare reasons. Antidepressants are a lot less expensive than psychotherapy. And for that reason, insurance companies often will push toward medication, which is relatively inexpensive, especially once meds are generic. They can be dirt cheap, as opposed to, paying the higher bills for psychotherapy, which may take longer, but for some types of mental health conditions is more effective than medication. And even those conditions that do require medication, the medication works better if it's in combination with psychotherapy.
Right. Unfortunately, that science is not trickling down
It's not.
to all providers, and it's certainly not being promoted by the pharmaceutical industry
Nope.
in conversations and
Yep.
many, many lobbying dollars that are being spent to buy
Huge
Congress.
lobby dollars. Yep.
So I think it's all something for us to keep in mind as we really do want to have a centered, discussion around this issue so that both patients and providers who are going to be impacted by these decisions understand the fuller picture, because sadly, it's just not that easy to get information from those of us who have been trained to know best. And even sadder, in my opinion, is that we're not being asked.
We're not. And, the pharmaceutical industry is extremely wealthy and, like you said, is a very powerful lobbying force. And a number of pharmaceutical companies make sizable donations to multiple political campaigns for what I hope are obvious reasons that I'm not going to say too much about because I'll get angry. So a lot of what's the standard of care is a business decision and a political decision and not a legitimate evidence-based healthcare decision.
Yes, absolutely. Could not be more true from the perspective of, I think, where those who have reached out to me saying, my gosh, what are you doing about this? Their perspective is certainly that it is a politically driven, financially driven, profit driven kind of discussion, kind of decision-making process, rather than rooted in medicine, rooted in the providers who they know and trust.
It's not patient dictated, no.
And we know too, and this is one of the things that really drove you and your dad to found CGI and to create the Doctor of Behavioral Health program, the idea that primary care became the default mental health system in the United States through the nefarious actions of pharmaceutical industry, direct to consumer marketing, take this drug, ask your doctor about this drug.
When
we're going to quietly say all of these side effects.
Yeah, just like the commercial. Oh, yeah.
Right. And so many primary care physicians and nurse practitioners and physician's assistants who I've spoken to, in the more than 10 years that I've been studying integrated care as a doctor of behavioral health, or, prior to that as a student, will tell me, well, I can tell them the side effects, I can tell them the harms, I can tell them the pros and cons. But there are people who come in and they just demand the medication. They don't want to go to therapy. They're not open to it. And I think they have valid concerns around that. I experienced that myself with a very, very small number of patients who really only wanted a prescription and would only want to go to a psychiatrist. But I think the much larger population of individuals who is taking an antidepressant or a mental health medication, a psychiatric medication at this time, is truly doing it because they've found it to be effective. And the idea of the rhetoric coming from RFK Jr. and the new presidential administration is very, very stressful for a lot of people, especially the idea of being put into camps. I mean, let's get honest. Let's get real.
Unfortunately, what bothers me about the current administration, among other things, is the fact that people being appointed to very high federal positions have no skills and no experience in the jobs to which they're being appointed. For me, it's not a Democrat versus Republican. It's not a liberal versus conservative issue. Is that person experienced in the job? If they're being appointed to head the FBI, have they worked in the FBI? Have they worked in intelligence? What is their level of experience? And here, in my opinion, we've appointed someone to lead Health and Human Services who does not have the background, who does not have the education, who does not have the qualifications, and seems to be promoting decisions based on complete lack of information, or worse yet, a lot of misinformation.
Blatant misinformation and
Yeah.
lies, outright lies, and just bad science. The
That's
type of stuff you would have seen in the National Enquirer if you were a kid growing up in the
yeah, yeah, yeah,
70s and 80s, as your parents were checking out at the grocery store. I was talking with a colleague about that earlier
yes, I
today.
remember those.
Just the idea that, anybody can say anything. Well, unfortunately, now we have conspiracy theory channels on social media
They're
that have the ability to reach thousands and thousands
everywhere,
more people.
everywhere.
And you don't have to buy that National Enquirer anymore. You just have to
Yep,
follow the,
yep.
trad wife or, whatever it is, hashtag or, influencer, and they're going to give you an opinion as if it is a fact that is based in science, but it's
It's not.
just not.
Yeah. And
So,
I wouldn't care the party affiliation, the gender, the ethnicity. I wouldn't care about any of that for who's going to lead health and human services, as long as they're willing and able to follow the science.
one of the biggest concerns for me, and this is something to go back to a comment that you made earlier in the discussion, is about the idea that this news may trigger individuals to feel like they need to come off of their medications cold
Yes.
turkey, which means stopping their medication right away. Let's talk a little bit about what that might do physiologically.
That's ill-advised. For one thing, people feel better on an antidepressant when the antidepressant is working. It doesn't mean they're cured. It just can mean that the antidepressant is working. And whether or not they're cured is a decision to be made between them and their psychotherapist. But going off the medication abruptly, number one, the rebound symptoms can be horrible. The depression can come back, the PTSD, the OCD, whatever is being treated with that medication can come back voraciously and very much overtake that person to the point of regressing where they're worse than they were when they started the medication to begin with. Contrary to what is being said in some of the media and promoted by some people in power right now, antidepressants are not addictive. However, they have a withdrawal symptom set. It's not like an addiction where you're craving a drug. But there are withdrawal effects. There can be gastrointestinal effects that are unpleasant. People stopping SSRIs in particular without slowly titrating under the supervision of the prescriber will feel what they call brain zaps. It feels like an electrical zap within the brain. It's not painful, but it's very annoying and can be quite disruptive to focus and concentration in one's life in general. And so it's really ill-advised to do anything that would prompt people to feel the need to cold turkey their antidepressant or any other medication for mental or physical health without the agreement and supervision of their prescriber. We may see an increase in hospitalizations, an increase in suicide rates if it should become widespread that people decide, I don't want to be put in a camp, so I'm just going to stop taking this. It is ill-advised for so many reasons. What we teach our students at CGI and what we promote in the Biodyne model is that starting or stopping any medication is done under the supervision of somebody qualified to help that patient begin and end that medication. This is not, a do-it-yourself at-home project. This is serious business.
Yeah. And I think that it's unfortunate because we've been in the mental health community and in the psychiatric community, probably in a little bit, I would say less than, but similar in those who have a prescriber's license. We have known about these side effects. We've known about the importance of not abruptly discontinuing a medication, stopping your medication without talking to your doctor or talking about, a titration plan, which means let's reduce the medication slowly and gradually over time and under my supervision so that we can track your symptoms, so that we can ensure that you don't become sick or have a resurgence of your symptoms to the degree that you can no longer function, to the point where you experience possible dissociation, break from reality. There are lots of different conditions. You mentioned bipolar disorder, which is a cyclic, experience of mania and or depression. And that can definitely be triggered by an abrupt discontinuation of an antidepressant or other medications.
Be triggered
and so
by
the concern
starting or by stopping, which is why we do both under supervision.
Exactly. And so, my concern is that we'll have individuals who will get afraid about the news and will be afraid to reach out to a doctor because they'll be afraid that their medical record will be subject to administrative review. And so they'll try to do it themselves at home by Googling or just not think about it at all. Just say, you know what, I'm done with this.
And who else
I'm not going to pick up that refill.
Yeah.
And millions of Americans rely on antidepressant medications. So the other concern is that there will be a ban on SSRI or other types of medications, and inability to refill a prescription is something that is really worrying people. And so, even before the ban ever occurs, when it's being talked about, there's a chilling effect on individuals and their behaviors.
For people who rely on particular medication, absolutely.
And it can also lead to really dangerous self-medication. So let's talk a little bit about what self-medication means and what individuals do when they can't access a controlled prescribed medication under the supervision of a qualified provider.
Well, when people are miserable, they want to feel better, right? I just stated the obvious. Some of our founding fathers in psychology talked about maximizing pleasure and minimizing pain as a central human goal. And we all do that. When we're in pain, whether it's physical or psychological, we want relief. And if that relief is not able to come in the form of therapy or a medication with a qualified provider, people are going to attempt to make themselves feel better. And that can happen by misusing alcohol, misusing other drugs. It can take the form of self-prescribing supplements that promise mental health relief. St. John's wort comes to mind. It's an over-the-counter herbal that's readily available. Because it's an over-the-counter herbal, people think it must be pretty benign. It's not. For one thing, herbals are unregulated in the United States. The FDA doesn't have to approve them and regulate them. The FDA only gets involved when bad things start happening to people. They may ban them or add warning labels or something. But because they're unregulated, you don't know exactly what you're getting. You can be getting less of the active ingredient or more of the active ingredient than what it says on the label. It's basically a certain amount of unknown. St. John's wort has SS-like effects, even though it's an herbal, it works in the same way. And a lot of our medications started as herbals. Aspirin came from willow bark, okay? So just the fact that it's an over-the-counter herbal doesn't mean it doesn't work essentially the same way that a pharmaceutical does. So you can take too much of it and have serotonin syndrome, which is a medical emergency and possibly fatal with tachycardia and all kinds of unpleasant symptoms. Unlike the SRIs, St. John's wort has some of the food interactions that monoamine oxidase inhibitor antidepressants have. So you can give yourself a difficult syndrome with dangerously high blood pressure because you drink too much wine and eat too much aged cheese and a little bit of pepperoni on the side one evening. So those things are dangerous. And what makes them more dangerous is that, people are responsible for their own health care when they choose
Yes.
to take one of these things, either to self-medicate with street drugs or alcohol, or to herbals that are reported to do a lot of the same things. That's not under the supervision of a doctor, and there's just an awful lot that can go wrong. Overdoses with interaction effects that consumers are not aware of. And so we're getting into some risky business if indeed these legitimate pharmaceuticals suddenly become unavailable and people are turning to any port in a storm to try to treat their own symptoms.
Right. And you mentioned overdoses. I think we are likely going to see an increase in overdoses and an increase in suicidal behaviors, as well as drug interactions for all of the reasons that you talked about. And I think it also, we touched on this, but, just the idea of self-medicating or the DIY approach at home is really driven by fear and a lack of trust in medical institutions, mental health institutions, or providers, because patients no longer can trust that their information will be kept private, that their private and protected health information will not be accessible to the administration who's seeking to put them in a camp, according to headlines.
And unfortunately, with the current administration in other areas, we've seen private things opened to reviewers. And so it stands to reason that medical charts could be opened to see who is on psychotropics and who isn't. We don't know that that will happen or not, but the fear that it may certainly will drive human behavior in directions that are unhealthy.
With those of us in, as I mentioned, the individuals reaching out to me saying, well, what should we do? Or what are you guys doing as a medical community, as a mental health community? If we as professionals aren't sure what's going to happen, we can't necessarily reassure our patients about what to do, how to take care of themselves, how to proceed. And so what ends up happening is that it really erodes that line of qualification in terms of who do you go to get accurate information. And this will end up in overburdening an already overburdened emergency department and crisis services, hospitals, hotlines. If they continue to receive federal funding, that remains to be seen. And psychiatric services are already hard enough to get.
Difficult enough with long waits and not always being adequately insured to access the services if you can't afford them.
And it will also overburden police and emergency EMT services, paramedics.
Health crises, yeah, of course.
So what we're looking at, even if you don't take SSRIs or antidepressants or, the medications that have been targeted, you're looking at an added burden or an added access barrier to receiving the emergency services that you might need because of the crisis that will end up burdening an already system that is already in crisis.
And, we've finally reached a point where we've successfully destigmatized mental health issues to a great extent. And more people than ever have, in recent years been willing to get mental health consultations and treatment. And a lot of the willingness comes from the confidentiality
Yes.
aspect of that and, a trust of a system that a lot of us have worked very hard at destigmatizing over a number of years. And if the confidentiality isn't there, if our government leaders are working to re-stigmatize mental health issues, people are not going to access the treatment that ideally they need to access. And as Dr. English said, that snowballs into all kinds of crises that overload other systems that are having to pick up the slack on people not being able to get a therapy or get a medication, or thinking
Yeah,
they can't, or deciding that they won't because of the privacy concerns and thinking they might end up in a camp.
exactly. Exactly. So with all of the worry, let's talk for a second about what, if anything, let's begin with, our medical community, the medical mental health integrated, community of medical professionals. What can we do?
We are a community. We don't always talk to each other. We don't always act like a community, but we are. And people who have read and understand the research, people who are qualified to write prescriptions, make psychotherapy treatment plans, make recommendations we all need to band together and to be one big, loud, screaming, maybe unified voice that says we're putting our patients' interest ahead of political whatever is going on. And, without banding together and being a unified voice, the politicians are going to be louder than the healthcare workers. And therein lies an enormous problem. We need to stand up and be the ones that do healthcare and not have politicians that have never worked in healthcare doing healthcare instead of us.
Absolutely. And I think that's also something that, with all of the marches, with all of the demonstrations, with all of the protests that are going on, and we've seen this from healthcare, professionals as well, who, are also speaking out, many of them on social media, and then receiving flack from the insurance companies or from the government or from Meta, silencing them to, really make an effort to prevent people from hearing directly from what we are trying to do. But I think the important thing, and the reason that I wanted us to do this conversation, was to let people who are currently taking medications or, are caring for family members who are taking medications that are incredibly increasing their quality of life. To let them know that we're not going to stand by and remain silent. We're not going to simply accept any type of order that would, change the quality of our care. We are in the same boat as all of our patients that we provide care for, in that we don't know what's to come. That we are, distraught about the news headlines. And that at the same time, we are going to do our level best to continue to advocate, to stick together, to use our power for good, our power and our privilege of being highly educated and subject matter experts in the science, the true good science of this area, to try to protect their access to the care and, when needed, medications that are life-saving and life-enhancing.
Absolutely.
And so from the professional organization standpoint, I know the American Medical Association and many of the other professional associations have been speaking out, and it's good to see that. And, I think the important thing to know is that It's not been easy for us as providers to keep licenses when we have spoken out against government-led initiatives at changing the law to interfere with the way that we deliver care according to the medical science available to our patients, when that goes against what the new law of the day, the new trendy headline or executive order says. It has not gone well for us. And what that means is that we do put our livelihoods, our long investments of education and financial investments in training to become the best provider possible, our license, it puts all of that at risk, but we're still willing to do it, and we're still doing it.
And, despite the fact that in recent weeks, we have seen an awful lot of people lose their jobs because of a differing opinion.
Mm-hmm.
I guess that's the nice way to put it.
Mm-hmm.
And that certainly could happen to any of us, but all the more reason for all of us to band together.
Absolutely. Absolutely. So I think, from the perspective of the importance of remaining connected to one another, remaining focused on the advocacy that is needed, and not getting distracted by, smaller kind of issues that might fraction off, bits and pieces of the total group of us to be able to advocate and push forward. Because, from the legal perspective, we're in doubt right now, because the law and the Constitution are not being followed. We're seeing that happen. We are seeing the intrusion into our ability to do medical care to the best of our training, to the best of our many, many hours of advanced continued education, and to the best and top of our licenses. And so we are going to have to seek legal assistance to fight some of these efforts, to support others as other providers are accused or fined or lose licenses. And we're going to have to partner with education and public health to make sure that we are working to improve the health literacy, which just means that anybody who lives in the community has access to information that they can use to make the best health decisions for themselves as possible. But that's something that's being censored right now. And that is a real fear. So again, we have to focus our efforts and work together, not unlike what happened when the CDC and the HHS and the NIH website, bits were removed to censor certain information if it had the banned words. Yeah. There was a huge effort behind the scenes to back all of that information up so that it wouldn't disappear, so that it would still be available. And I think that's a huge part of what we as providers in community can do for ourselves, for our patients, is to, continue to seek ways to share the expertise that we have to help people make health decisions and to save lives ultimately.
And hopefully to be louder than the disinformation and misinformation that's out there.
Right. And, I look to history. I am a history-obsessed person, have been my entire life. And, for whatever reason, a lot of it was focused on how could the Holocaust possibly have happened, as a young girl, not understanding how it could possibly have gone that far off the rails from a human perspective, and seeing a lot of those same types of things happening in the last 30 days.
Oops.
Yes. So I think, just the need for us to understand that, history repeats itself, that humans are not very good at learning from our mistakes and, stopping the cycle from repeating itself, and that the same can be said from resistance movements, and that, sometimes those resistance movements have to be done behind closed doors or underground, and that we too may need to participate in some of those efforts to save lives. That's just the bottom line.
Yeah.
So I think, protests, strikes, marches, I've been seeing, reports of those that we can look to from history, who've gotten in that good trouble, who have been accused of civil disobedience. And I saw a report this morning of a Catholic nun who had been arrested over 40 times before she passed away at the age of 83 for protesting in the name of protecting the community members and providing information and equity to the community. And those are really my heroines and my heroes, because I see them standing up for what is truly right. And that gives me hope.
Yep. I've always wanted to be a Rosa Parks or a Harriet Tubman.
Mm-hmm. Yeah. I have a lot of what I call collective ancestors, who live in my heart and, drive me forward and give me inspiration in dark and difficult times like we're in right now. And so, the message of hope, I think, is very, very important. And the hope, I think, is that we have community. It's here. And so despite the news headlines, despite the executive order, despite who's in the White House and who's in charge of all of the offices who shouldn't be in charge, if we can stay focused on the services and the support that we can provide to one another through these times, I think that may help us.
Yeah. And we've got jobs to do and we need to focus on them.
That's right. And there's no, I was joking with a nurse friend of mine about, just the state of a 12-hour shift, how a 12-hour shift is never 12 hours. It's a minimum of 14 hours now. They may tell you just sleep here, just stay all night. I can tell you that there were times where I did. I've slept overnight in psychiatric wards. I've slept overnight in the birth center. There have just been things that you do as a healthcare provider that I don't think patients know we do all of the time. But we do them because the work matters to us, and we became healthcare workers because it's the right thing to do. We have a passion for it.
Yeah. Well, the Biodyne model has a motto, simple, do the right thing. And all of our ethical decisions, our treatment decisions boil down to that motto of do the right thing. What is the right thing for the patient? Not necessarily what's the right thing for our convenience or what's the right thing for people who like to run departments that they have no experience in or whatever else, but what's the right thing to do for the patient? And that dictates our moves, every move within that model.
Right. I completely agree. I was looking at a video the other day of a physician who was talking about, it doesn't matter what is dictated. I will continue to follow the oath that I took. The Hippocratic Oath, not to mention the ethical oaths, the ethical codes for our professions, all of these indicate that you do your absolute best to provide within your scope of practice for the individuals that you serve. It is a service position. So if you have bias, if you have prejudice, if you feel like you don't want to treat somebody because of your religious beliefs, then find another career. That's the bottom line. Yeah. Because you took an oath. All right. Well, Dr. Cummings, thank you so much for being here with me for this difficult conversation, but definitely one that had to be had. Yes. We hope that this information has provided some helpful, valuable tools for you. And if you have any questions, please don't hesitate to follow up with us. My email address iscenglish@cbi.edu. And you can find more about Cummings Graduate Institute online at cgi.edu. And you can get in touch with us that way if you are looking for tools and resources to help members of your community. So again, Dr. Cummings, thank you so much for joining me today. All right, join us again next time.